Hello everyone, welcome and thank you for being here. This is Dr. Nidhi Rawat. I make videos related to homeopathy. In this video, I am going to share how to select potency in homeopathy. As you all wanted a video on this topic, so here it is. Especially medical students and young budding doctors have so many questions regarding potency selection, like what is the criteria, how to evaluate which patient needs which potency. But let me tell you, these things will only bother you for the first few months. Within 6 months of practice, you will see that it is not as much as complicated as it appears. But in the initial days of practice, we just need someone to simplify things for us. We all know that it is a trial and error process, and we will eventually get through this. But when we sit on this chair and get stuck at some step, we just need someone to tell us exactly what to do. So, I am going to tell you 5 points to consider for doing a better potency selection. At the end of the video, I will tell you a general method for the repetition of potencies. So, stay tuned and watch the video till the end. Now, it is said that potency selection is based on the susceptibility of the patient. What is susceptibility? Susceptibility is the general capability of organism to receive an impression or the power of the organism to react to stimuli. All the physiological and pathological functioning of the body depends upon it. The power of individual to react to curative medicine also depend on susceptibility. Now, all the points that I am going to explain are the factors that modify susceptibility. So, when you will consider all the points, it will help you to determine the susceptibility, and then potency selection will become an easy task for you. So, let's start with our first point, that is age. Age is a very important criteria for selecting potency for homeopathic medicines. First of all, you will have to consider the patient's age. I am telling a general concept of potency according to age. Use 30 ch for infants and small children, and do not repeat the dose frequently. For children about 12 years, you can give 30 ch or 200 ch. You may repeat the dose once daily. For adults, you can prescribe 30 ch or 200 ch. The repetition can be once or twice daily. You can also give 1 ml and repeat the dose weekly. For older age group, you can start from 200 ch and repeat the dose twice or thrice daily. You can also give 1 ml and repeat the dose once a week. Now, our second point is the onset of the disease. Potency selection and repetition of the dose also depends upon the onset of the disease. Whether the disease has a sudden or gradual onset will help in deciding the most suitable potency and repetition for that case. In acute conditions, you can repeat the dose frequently. For example, 30 ch 3 times a day, 200 ch twice daily. In chronic cases, you can start from 200 ch and gradually increase the potency in subsequent visits and follow-ups. In chronic cases, you may give up to 1 ml, 10 ml, 50 ml or even cm. Now, our third point is the intensity of symptoms. According to intensity of symptoms, the repetition may vary. Try giving moderate potency or high potency if the intensity of symptoms is very high. For example, 200 ch twice or thrice daily or 1 ml once daily. For low intensity symptoms, you can give low to moderate potencies and repeat the dose once or twice daily. coming to our fourth point, that is mental symptoms. If mental symptoms are more clearly indicated and match a particular medicine then you have selected, then you can start the treatment with higher potencies. But don't repeat the dose very frequently in the cases where mental symptoms are more prominent and your selection is based solely upon the mental symptoms. Now our fifth and last point is previous treatments. Previous treatments and abuse of drugs might make a patient less responsive to lower potency. So try to start with higher potencies for such cases where the patient is giving a history of taking large amounts of heavy doses of medicines. You may start the treatment with at least 200 ch or 1 m. Not to miss a very important tip for potency selection in skin complaints. If you are a beginner, avoid giving high potencies for skin complaints. Always start with a mild potency, let's say 30 ch. It will help you to manage the case effectively. Skin is a sensitive issue for everyone. You will need a certain experience to tackle the case after aggravation and to deal with patients who might complain about aggravation even after being told about it. So better to start with milder potencies and gradually increase the potencies in follow-ups. Finally, we have discussed the 5 very important points that help with potency selection. Now, if you are a beginner and just started the practice, you can follow some very simple rules which may help you to effectively treat and manage the case. What are these rules? If you are using 30 ch potency, you can repeat the dose thrice daily. If you are using 200 ch potency, you can repeat the dose twice daily. If you are using 1 m potency, you can give the dose once weekly. For more higher potencies, wait at least 15 days between the dose repetition. These points have been explained to you so that you can have the confidence to start your practice. So I have tried my best to explain points systematically according to what I have learned from my mentors and my own experience, of course. Please like, share, subscribe and hit the bell icon so that you can easily watch all the upcoming informative videos.